Thank you, everybody. It's a pleasure to be here, a real honor to be representing the South Bronx. So I have built in quite a number of pictures so you could really get a good idea of some of the work that we do. And this is really going to come from a different context because it's a real community-based effort that our organization has in terms of improving health literacy, not only for the community, but also within the patient setting. So we do a lot of outreach work, a lot of health fairs, a lot of waiting room presentations, and then we also have some work being done actually within the setting, within the health centers. So just a little background. This is my dad. He's the founder of Urban Health Plan. He's a local physician. Oh boy. Who's been in practice for over 53 years. I always say I'm not going to do this. I always say it. He grew up in the neighborhood, started his first practice in the neighborhood, and really just embraced that neighborhood. So our health center was always founded from a community-based grassroots orientation and from a physician who really believed in community. So he is a person, but when he was practicing full-time, he would do house calls, he would allow people not to pay for his services, and all kinds of good things that doctors back then did. So in 1974, he took his practice and turned it over into a not-for-profit licensed organization. And in 1999, we became a federally qualified health center. As was said, here's a little description of the type of services that we provide. We've had a fully implemented EMR system since 2006 with all of our health education and counseling fully integrated into the templates and always working to enhance it. We currently have a staff of 730 people, and just to point out, we not only work with the providers. Our providers are all culturally, linguistically proficient in the population that we serve. We serve a predominantly Latino population, and so a lot of our health literacy efforts are focused around health educators, our nutritionists, our patient navigators, care coordinators, case managers, and volunteers. So there's a lot of work that goes on outside of the doctor setting per se, and I'll go through with you how we've done some of this. And we also have some preceptorships. Of the one that I really want to mention is the one with Sophie Davis School of Biomedical Studies, where we have medical students that come into our facility and they work with the patients in terms of patient activation. So the idea is, how do they actually get the patients to start asking the right questions when they go in to see their physician? This is our patient-centered home model, which you probably have seen something similar to it. And a lot of our work around health literacy is focused strictly around the support services piece of it, whether it's through the outreach health educators or the like. So in terms of the attributes, when I looked at them, we really meet all of them, and maybe not in a very traditional sense, but I'll briefly go through some of this so that you see what we do have. So our leadership, we've made health literacy important to us. Our patients are the most important things that we've done. We were actively participants in the health disparities collaboratives that HRSA put forth, and through that we learned about self-management, and so that's how our health educators came into the organization as a way of addressing health management through our quality improvement efforts, and we've supported them. We started out with one about 10 years ago, and now we're up to 18 of them. We integrate health literacy into performance improvement, so it's part of what we do through interdisciplinary teams. We prepare our workforce to be health literate. We have a learning center for professional and personal growth, where we have provided classes on motivational interviewing, how to deal with difficult patients, how to develop a curriculum for certain chronic illnesses, and the like. We include all the populations, so everybody is treated the same. That whatever materials that are put out there don't really identify one versus the other. They're done in a way that could be standardized for all. We use health literacy strategies in interpersonal communication. We're always aware of how we talk to our patients. The fact that 95% of our patients speak Spanish is very helpful in our community. We hire from the community, so 60% of our community is represented in our workforce. And so we kind of have that linguistic proficiency kind of built into the culture of the organization. We also provide easy access to health information and navigation assistance. We have greeters. We have a bunch of them, and we're building a new building, and they're built into that as well. And as you could see, we just really are, we really believe that we're a fully health literate organization. So why was our interest in improving health literacy? Like I said, we have a history of what we were founded on was a real community grounded basis for believing in this work. We also come from the community health center world where everything is really community based, and we believe in that. Our mission, our core values include things like cultural proficiency, innovation, performance improvement. So it really speaks to individual attention, family orientation. So they're all the things that health and literacy speaks to. We have the leadership commitment. The work with the health disparities collaboratives really made us aware of the need to go beyond the community and actually work within the provider setting, and we understood the value of it. And we have some studies that have actually been done with some of the health plans where show through our efforts how we've actually cost the health plans some money. So some of the formal strategies that we've used to move health literacy forward. One is the role of performance improvement and including health educators and the like in our PI teams. We've used the CARE model, and so I agree that the attributes of health literacy are a great way of looking at incorporating health literacy into the practices. We've invested in staffing, so you could see all of the staffing that we have there. Our use of space, so our clinics or our units within our health centers are not only exam rooms, but we've actually integrated into them nutritionists, health educators, and care managers so that they become part of the entire team. So as a patient is being seen, they can be taken from one area to the other without having to go up and down different floors. So we've integrated all of those disciplines into the units. We use data. Everyone knows how to use data. Our MAs know how to use data. They all report on it. They've all reported to our board of directors, so they're very fluent with the use of data. We have partnerships. Some of the partnerships, this picture actually is a partnership from the Canyon Ranch Life Enhancement Partnership that we have, where we've actually been able to take a program that a place like Canyon Ranch has and replicate it into the South Bronx and really show good results for it. We've actually demonstrated that for close to the 100 people that have gone through that program, we have seen significant drops in their depression scores. So, and the program focuses on a lot of health information, giving people information at the point that they need it and to make real improvements in their lives. We have a director of health literacy that was recently brought on to kind of coordinate all of this and kind of move the work forward, knowing that we started at one place and now that we're ready to move further and integrate the work within the organization. And also the Learning Center. The Learning Center was really created as a way of understanding if you wanted to continuously improve health care, you had to continuously train your staff. So you couldn't really separate them. So we have courses in there that are going to start including work on PI as well as some health literacy courses on actual approaches. So factors that facilitated this was I think one that's sometimes overlooked is having a stable organization, especially in health centers that may be vulnerable. either financially or operationally. I think one of the fundamental things that you have to have in place is that you have a stable organization. If it's in flux and you have financial problems and you try to do this work, it's not going to work because the resources have to be spent in other places. We had our board buy-in. They were definitely, our boards as an FQHC are made up of at least 51% patients. So we had definite buy-in from our patients that this kind of work was something that we wanted to do. I bought into this. I was very aligned with our chief medical officer so that we could assure that the provider buy-in was there as well, because we understood how difficult provider buy-in can be. So by having the chief medical officer on board, it made it that much easier to move the work forward. We've had successful and sustainable PI projects that have shown significant improvements, and so when you have that, it allows you to really continue to move the work forward. This picture is actually an initiative called Shop Healthy Bronx, where she's one of our nutritionists who actually is in a supermarket doing a food demo. And the idea is to increase the use of fresh vegetables and produce and make healthier options available to the community. We've integrated the health educators and the other care coordinators into our care teams, like I said before. The positions have been built into our budget, so they're kind of ingrained there, and that's important in order for sustainability. We have valuable partners, like I mentioned before. And the New York City Department of Health and Mental Hygiene are a huge, huge partner. They provide us with very appropriate health information and pamphlets and brochures. So what we try to do is really to utilize whatever resources we find out in the community that could support our efforts. So what we do is we see patients, and we develop those partnerships within the community that could then help support our efforts around health literacy. And we use data, a lot of data, so that people could really understand what we do. Barriers, I think one of the barriers has been standardization of key messages, and how do you build that across our entire network. So with the help of the Director of Health Literacy, we believe that that'll happen. Finding the right staff. We don't use nurses as the health educators. We actually use bachelor-level health education people, or MPHs. So getting the right staff on board that are culturally and linguistically competent continues to be a little bit of a barrier. Finding the right leader was a bit of a challenge. We found a really good person who sees the whole scope of what we're trying to do, and then assure that we have continued funding to support this work. And this picture is a picture of we have two WIC centers, one in the Bronx and one in Queens, and the Bronx WIC participants that are breastfeeding did a subway caravan, and they went from the Bronx to Queens to really stress the importance of breastfeeding and to increase awareness. So that's really the kind of things that we do that really help us get to where we want to be. So how will changes be sustained? This is ingrained into our staffing. It's ingrained into our budget. Unless we have a financial catastrophe, it won't be, but they're there to stay, and they've been there for 10 years now. Fully integrated into the care team, so the providers accept the health educators. The fact that they're in the units really helps the use of the staff. I think this will be supported by payment reform. I think as we move from volume to value and really starting to see some savings that come back to the health centers. Right now, we're not part of a health system. We're an independent, federally qualified health center. We've been able to negotiate some shared savings that help pay for this type of work. So we believe that as we move more towards prevention with healthcare reform and payment reform, this will be sustainable. We continue to seek outside funding, and we're well integrated into the culture of our community. This picture is actually a picture of an adolescent pregnancy prevention program that we fund, where the health educator on your right hand side is providing information on reproductive health to participants. So we do this really at a very grassroots, community-based level, with the thought of bringing it more and more into the medical practices as we move along. Thank you. And so this is my last slide. This is a knowledgeable community becomes a healthier community. This is in the far back you could see Urban Health Plan. That's our main site. And in the front you could see this is one of our health fairs that we do with the abundance of literature that's given to the communities. And we do this not once a year, but we do it throughout the year in multiple sites. So thank you.